You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hello, Sarah. How are you?
I'm fantastic, Doc. How are you?
I'm good. I'm good. Thanks for coming over. It's an interesting history you have. You started off as a nurse, and I'm curious to give us a little bit of an overview how your career went until now. Can you do that, please?
Sure, absolutely. So I was actually, before becoming a nurse, I was a biotechnologist. So I have decided to live several lives in this one life only. So I started off as biotechnologist and I love the science, but I felt like I was missing because you become very, very computer-like. After some time, you become very analytical. I mean, you're good at what you're doing, but you become just very analytical. And I just wanted to be more involved in people and improve myself emotionally as well. And you have to put yourself in places where you're challenged emotionally. You just cannot just start becoming emotionally intelligent. So I found medical, after I did do some clinical research as well, I said that let me explore medical field. And the more I explored, the more I started becoming better as a human, better as a person. So I decided to become a nurse. And it's been more than 5 years that I've been a nurse. And last year, I just had an epiphany, sort of. I was not very happy with a lot of systemic changes that are, that are across the board, healthcare wise. And I think there is
Yeah.
a major need. And I was very sad that so many, I was also a nurse leader. So in that position, I was able to find some of the issues where patients were getting admitted in the hospital frequently and for prolonged hospitalization and acuity was increasing. And so I decided, what can we do to change that? And so my marketing company and my entrepreneurship or the business strategies are help to promote businesses of doctors, nurses, and chiropractors in a way that the patients find them in the rudimentary stages of their disease so that it has way better outcomes. So my company's motto is early detection, early intervention leading to better prognosis. So marketing strategies are geared towards marketing, branding, and business strategies that are geared towards helping align those patients with the right businesses at the right time at the rudimentary stages of disease. That's my goal.
Interesting. So how did you make this transition in your mindset from being a nurse to become a digital marketing company CEO?
I think a decision like this that is so emotionally involved and financially involved and time-wise involved and sacrifice-based. I think for you have to have multiple touch points. There are so many, like one of the touch point is that I wasn't happy with the way systemic things were going. I wanted to really make change in the medical leadership. But I think the inception of all of this started when I had a heartfelt conversation with a patient. It was a change of shift and I ended up crying with a patient for 45 minutes because she asked me a very hard, heavy information. It was like she was diagnosed with cancer with very poor prognosis, very unsupportive family dynamic, and very debilitating conditions with her children as well, and no support system. So she asked me, I mean, my children are coming to me tomorrow. They're going to visit me. How am I supposed to tell this to my family that I have cancer and I'm dying within maybe 6 months? And it just took me right back to my dynamics with my father when I lost him at the age of 16. So the doctor gave exact diagnosis, he's going to die in 10 months, and he literally died 10 months within those 10 at the very accurately in 10 months, 10 days after I just had turned 16. So it just took me back to that moment and I was like, I gotta change this. If this healthy woman who is like a dancer, she does not have like purely healthy person. She just came from a dancing class and she started having back pain and it just was metastasized everywhere. So then I was, studying Mind Valley. I was studying energy medicine. I was doing regenerative medicine studies and stuff like that. And I was exploring how can I build a legacy for myself. You need to have a why when you're doing it, and also leave something impactful. And also, so I was studying various like mind sciences resources and scholars all across the world, and that's actually one of the reasons why it led me to go to Johns Hopkins as well. And so when I did all of my research and I calculated my aptitude and my what I want to do and achieve, of the 23 businesses I was investigating, I did marketing, coaching, and Amazon. I did not like Amazon at all. It was too, I love maths, but I don't like analyzing maths and capacity of sales per se. I do want to do coaching at some point, but marketing was where I thought that I could bring both my biotechnology nursing background and my nursing leadership background. So those,
Interesting.
I'm
Yeah.
sorry, I went so far in this, but there are
No, 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 no.
multiple
That's very
touch points
interesting.
on that.
I think it kind of portrays a transition in your mindset that's very important for a lot of people to realize that, we don't have to be stuck in our daily comfort zone
Hmm.
all the
Hmm.
time. And the moment we realize that there's so much out there that we can explore and try and accomplish, for your own sake and for the community's sake, right? Because
Hmm.
you had this experience with someone that kind of change your path. So I think it's important for people to realize that you listen to those podcasts, you listen to those people like yourself that are changing their life at some point due to an event, due to
Hmm.
a crisis, or due to an experience that kind of open up a different point of view, right, in your life.
Hmm. Hmm.
And finally, you find your pleasant moment, right? Your point of resonance basically in your life right now. You do what you like, you do what you're
Hmm.
good at, and you help other people by doing it. So tell me a little bit about your business. How do you plan to go with it? What do you want to achieve? And, what are your goals with it?
Well, first of all, I need to say a special thank you to you because Edward, kind of appreciating how people are evolving outside of bedside by giving back to bedside. That's a big achievement in itself. So thank you so much for creating this podcast that does showcases how a different kind of mindset could achieve a different kind of a goal. Um, so with
Thank you.
that being said, what I do in my marketing company is that I do a thorough analysis. Part of the reason why my marketing agency at least, is different is because I made it very clear that I will study the business first. I do not allow, I shouldn't say allow, that's a very odd kind of word, but I don't take people, like a lot of time people would come to me, can you brand us? Can you market us? Can you do that? I study the business. I say, where is the value piece? So if I feel like in their branding or their messaging or any target audiences, if that is missing, then the business is not going to be successful. So I am very, very purposeful and intentional to align with businesses where I'm very clear on what their goals are and if they are trying to make an impact. So sometimes I have actually said very, very hard no's in the process as well, because it just seemed like it's not, it's my name on the line as well. So I just was like, okay, I love what you're doing, but it doesn't feel right. So I'm very careful when I analyze businesses. I say, okay, maybe if you do this way, you transition from this way, you are going to attract more clients that you're not even seeing, and you're also going to help them, and you're also going to grow. So those are some of the things. So I have like a criteria of 20, 30 things that I ask. I do full analysis. Then I suggest where there are, what are their gaps? Are there gaps in their branding? Are there gaps in their marketing? Are there gaps in their sales? And then I align it with their goals. What are they? Are you trying to achieve sales? Are you trying to achieve marketing? Are you trying to achieve? They have to be happy. Their own clients have to be happy. And my vision has to be really aligned with all of this. So those are the three main things that I'm looking for. But the basic business is only for healthcare, because I understand clients, like patient psychology, I understand the infrastructure of healthcare. What are some of the policies and procedures that could be a good for a marketing per se, but it's not necessarily going to be a right strategy from a business point of view. So those are some of the things that I'm very intentional and very like conscientious about addressing it to people who come to me and want to take my services.
Yeah, this is very important, and I think who are your clients in general? Like, what kind of healthcare companies do you serve?
I don't do hospitals because they usually have their own structure and there are lots of moving pieces. As a business, I have 7 people who we are a company of 7 people. I being the owner, and so what we do is we provide for chiropractors that are small practices. We don't do big chains that are all across USA. I mean, if we find it, we find it, but I don't think that we are ready. We want to be ready. That would be our future goal. We want to be ready for that. But especially small businesses, when I did my research about this business, marketing business, I was very adamant about finding the why. And what I was able to find in a few of my resources, and if you check out my website, it's also written over there, that I found out that between 20, oh my gosh, I can't even quote my own website. But anyhow, in between those 2 years after the COVID had hit, at least 42,000 businesses all across USA had stopped because they were either asked to partner with the hospitals, or they had to let go. And how it has affected our patient care infrastructure is now patients have to pay more money because the doctors are now have to ask for the affiliate like if the hospital owns an MRI machine or an X-ray machine, they are kind of move towards those services, as opposed to when they are on their own, then they can refer them to any other resources that may not cost them this much, and they're also within their network, they have a choice. So those are some of the things that when you are taking facility from a hospital, the same service can become very much expensive. Whereas, say, if an orthopedic clinic is by themselves and they have an X-ray machine and all that, that would cost them cheaper. So I love to help those businesses so that, and in the end of the day, a patient can get very good service at a cheaper price. So that's one of examples. And then nurses, some of my nurses are that are doing business with me are fertility specialists. Some of them are coaches. Some of them are legal nurse consultants, and then orthopedics. So yeah.
Very interesting. I mean, that's a great goal to have. But let me ask you something, and I'm playing devil's advocate right now. Why do you think a healthcare company or service needs marketing?
Why do I think marketing? Okay. Because there are people who you must have, as a doctor, you must have seen firsthand how some people not need one, like for example, if somebody is diabetic and they have developed PA or PD and they are just PAD and they have like foot ready to go into gangrene stage, they don't listen to other doctor, but they are in desperate need of help. And then they go to another, they take second or third opinion and stuff like that. Finally, when they get gangrene and they have septicemia in all of their blood and all that, then they realize that if they had done foot amputation, we could have done it. So a lot of times people do not have, basically the reason why I'm bringing this, that our mind is so programmed that I can do it myself. And there are personalities that are thinking like, I can do it, I can fix it by myself. You need a little bit of strategic marketing and purposeful marketing, not just any marketing, but purposeful marketing where you help people understand that this can be a problem and you may need to have this, information. Now, hospitals already have a very high budget for marketing, so they're all over the place. They'll go to affiliates, and the patient is going to say, oh, I know somebody from, let's say, their own local hospital that have multiple clinics, they're going to go in there. But what if a doctor is there and they're excellent doctors, they want to bring their own legacy in mind, and they want to leave their own personality, they don't want to compete with hospital policies or be servant to those hospital policies, they feel like that they do need marketing. Otherwise everybody will go to what's more obvious. They will be lost in the crowd, and a lot of them end up they build relationships. Another format of marketing is that a doctor has like 30-40 years of different relationships that he has collected, and from there they do word of mouth, they know primary care in their area, so they may not need marketing. Not everybody is a client for marketing. So if they're doing, one of the criteria that I ask, that why I do ask this question actually, why do you need marketing? Like, why do you, if they say that I am doing it with word of mouth and I do some other analysis and they're meeting their goals, I don't sell them marketing, because I want to feel purposeful. If I'm connecting with you, I want to feel that I'm bringing value to you. So yeah, to answer that, yes, most businesses do need marketing because they're different kind of patients. But if they are satisfied, if the doctor feels or the nurse feels that they don't need marketing, then I don't sell them that. No.
Now, I want to go back to yourself a little bit more. And, you know, I don't know. I mean, I'm sure you know, but I want to ask you, what do you mean what does it mean to you to be successful in this business? Like, what do you want to accomplish to call yourself successful in digital marketing for healthcare? And in the same time, was there any point in your life so far where something didn't work out and you
Oh,
kind of had an experience that switch the gears for you and learn from it, move forward, but it's still there?
like the effect of it, that
Yeah.
I put it in fact, it's a factorial in how I do decision making, that kind of
Yes.
an event. Gosh, there are a few of them. Um, oh my gosh, there are a few very significant one of them. I have
Yeah,
to figure out
give me
how
an
I can bring.
example so I can, people understand what does it mean and how that transformed you in your business.
Okay, so I think this would give the audience and people the most value. I think it was one place when, and I'm not, pointing at anybody or anything like this. I was really doing very well as a nurse. I was making six figures, and then I had asked one of my bosses to give me a leave because I wanted to perform a spiritual activity with my mom. It was something that I really had decided 2 years ahead of time, and finally I was at a good financial place where I could afford to do it because you had to go and pay certain things and all that. And so I had asked like I think I asked them November, and then in between when April came, which is where very close to where my holidays were supposed to start, or yeah, I think it was March, I think. Yeah. And there was some switch in our administrative policies, or there was switch in some kind of administrative things. Nothing anybody can control. I don't have anything against them, but the way it was handled, my need to go on a vacation was not done very well, unfortunately. And I was like, I'm never going to put myself in a position of disrespect. So when I feel that when my work is not valued, I just very respectfully move off of this. I may lose financially, but I gain in dignity. So that's what I've learned. And sometimes I'm still learning. I mean, sometimes it comes in so many shapes and forms that once the flood is gone, then you realize, oh, I was in a tsunami. Wait a minute, I've been there before. But at least you know, okay, this has also this kind of a shape. But I'm very, very conscientious about that. If I'm putting my sweat out there, if I'm making a difference, it has to mean something. So I just move away from people. I just
Yeah.
say, okay, love and peace to you. I love you guys, and I'm leaving you to with very positive thoughts. But I cannot give my more energy to you. And this is a very beautiful lesson to me. If this the gain is the lesson, I'll take it with a lot of love and kindness. That's where I'm at.
Interesting. So now, we live in an era that everything is online, right? We can find answers online, we can research online, we can ask back to Google, we can find all kinds of things. Now we have AI, ChatGPT is on everybody's phone. Why do we need digital marketing for a healthcare practice? And how do you best accomplish that?
Oh my God, this has to be the best question asked in all of the podcasts, and I'll tell
Right?
you why. So one of the examples, I was in this social, we were doing I was in this event where we were talking about AI and all that. So this would be fascinating to you. And then one of the, nurses that I had a very good chemistry with, she was like, we were talking about exactly marketing stuff. And I'm sorry, I'm again a little bit blurred, but the context was that somebody tried to sell a very important stem cell biotechnology, robotic sciences, um, in which all the stem cells are going to be replaced or some kind of a very fancy technology, but it will be all done by AI. And the nurse said that when I was in that crowd, there was like a tacit, maybe not, a kind of like a fear or kind of like a restraint in people's behavior that I don't think I'm accepting it this much. So whenever there's a technology that come in there are phases that I feel like that happen. The first phase is skepticism. Okay, is it going to work? Is it not going to work? Is it? And even right now, the fringe where I'm at with technology is copyrights. I'm very big on copyrights. I mean, I'm very careful, whatever. I'm even affiliate for some of the AIs that people have given, have asked me. Some of the popular businesses on LinkedIn, they have reached out to me for, to be an affiliate for their AI stuff that is great for marketing tools. And when I looked at it, the first thing that I noticed is not how it performs, but how safe it is in terms of copyrights. So that's so you have to pick and choose your battle. The other is, how is it working? Can I use it? That's the second phase. That adaptability. How much is the adaptability? Then comes the hype and the success rate, and people are like, I plugged this button and I got billions of dollars and all that. See, this is a very good. It could be seen as a serendipity and also a two-headed sword, or however that is phrased. Because when people are talking about AI, I'm going to do it in AI, and people have come to me. There was one of the doctors who came to me and they said, why don't you make my whole website on AI? And I'm like, we can, but that's not how I do business, because your copyrights are not going to be transferred. There is legalities. Tomorrow, if somebody else makes the same website for a competitor makes it, I have no way to protect your content, do I?
Yeah.
So that's where it's about knowing your own boundaries. So if there is an AI, sure, people can use it, people can create ads and all that. My thinking is, where are your boundaries? Where do you set the boundaries? To me, copyright infringement, Intellectual property stealth is where I draw the line. I don't use an AI. I'm a big fan of AI. And in April and March, I did do a webinar that was my first webinar that I ever did. And it already got like 200 and plus impressions and not impressions, but 200 and more engagements already. And a lot of people benefited from that. But I don't sell things that I either don't understand or so yes, AI can do marketing for you. GoDaddy does it all the time. That's their big selling point. Like you can do all your marketing and all of that in seconds. I've actually tried GoDaddy, nothing against them. People do work on that and people may have gotten success. Do I appreciate the lack of humanness in it and too much the same monotony of projection of how they do it? Maybe not so much. And I'm not against GoDaddy. Please use it. I use it too because my domains are purchased. Mine and my clients' domains are usually purchased. So I like them. There are parts of it that I love it as a business. But do I endorse AI just because it's there doesn't mean it's used. Just because a shoe is sitting, but if your foot is 7 size or you're wearing size of 11 doesn't mean it's going to look good on you, that kind of a situation.
Yeah, that's a very interesting thing. I never thought of this issue with creating digital marketing. What would be the best way you advise someone to market their practice at this point? Like from the spectrum of ways to do this, right? Because like you gave the example of a doctor who comes to you and says, "Okay, I have this kind of practice. How do I market myself to the patients?" What would be your advice to, after your research, after your business overview in this world? What do you think the most effective way is?
So I'll go back to what I kind of go through. So there are 3 things that I have to accomplish necessarily with the marketing strategy. A, your goals have to be met. B, we are very clear on the value piece. C, it should match my values as well and what I'm trying to achieve too. So unless you're not making an impact, it's never going to be a successful business. I don't do market just because it's there. I don't do quick fixes and all that. I'm looking for what is the sustainability of the business. To me, marketing is a portion of what you do. It's a process where you means to the end. But in the end, if it's not good for your business, and a lot of times, unfortunately, people do have certain ideas about how marketing should look like, but it may not be necessarily a good plan for them to market in a certain way. Like, for example, if a doctor's personality, and I'll give you this because this did happen. I saw this doctor who had a very good, charming personality, and they were exceptionally good with more like geriatric plus people of, more mature adults, sort of like a little bit after 30s adults, but they wanted to target adolescents because their daughter was adolescent and there was just some kind of a hype that she was really attracted to. So I said, why don't you before you do marketing, why don't you do a test run with adolescent and see how it goes? And, she was like, yeah, I like it because my daughter is in that age, but I think I should go back to geriatrics, and that kind of feel. So value. If a doctor is giving so much value to a population, then I'm going to say, maybe let's try it this way. We will do marketing, let's do a test drive with this, and then we will do a bigger launch. Because I'm sensing certain things, and I'm very conscientious of seeing where the doctor's personality is, because I've seen doctors when they smile and when they're happy, their performance is very different. And same for the nurses, or same for any business. So it's the value piece that, I try not to lose sight of it.
Yeah, you sound like you're gonna be this like orchestrator behind the scenes for their practice, to show them the way, how to reach out to people and stuff. And a lot of people don't understand this because I mean, normally, a doctor and healthcare professionals, they're not trained in this, right? They're not trained in marketing. They don't know what the psychology of masses is, how to penetrate an idea and all this stuff. But how did you learn this?
How did I learn this? Because I've had multiple lives. I've told you already. I mean, I did say that, but I didn't say it in that context. I see that. So I learned differently when I was doing biotechnology. I learned differently when I did clinical uh, uh, research. And then I learned very differently when I was doing nursing. So I think it's all of those experiencing. Plus, I grew up in Pakistan, so I have reference of a different culture as well. I lived in multiple states and I have traveled as well. So I think those are some of the, I don't know. I think This is a very, I feel like I'm boasting at this point. I feel like I'm not sure how to answer it. And
No, you don't. I mean, you don't have to have an answer. I'm just trying to have a conversation of people like you that branch out in different areas. And, you're obviously a very open-minded person. You got out of your comfort zone and you explored this field that you felt attracted to, and you're very successful in it. And I feel like you're projecting a sense of expertise because you have that vision, right? You show a vision, and if you have a vision for your business, the practices your marketing are gonna have their vision,
Mhm.
and it's important for people to realize this, that by partnering up with someone like you gain twice, right? You gain from your practice, and you also gain from your perspective of like bringing that business to a different level.
Mhm.
So I
Thank
have
you. It means a lot. It means a lot coming from a very experienced doctor. And I have looked at your profile. You have years and years and years ahead of, your, I looked at your profile. You have way much more business acumen than I do. And so coming from you, it means a lot. Thank you.
No, and that's what I'm trying to accomplish with this show, to show people that it's possible to do that, no matter where you're coming from and no matter what kind of experiences you had.
Mhm.
Life is open for everything, right? So, and you can
Mhm.
start everything at any age, and you be
Mhm.
very successful by doing it. It's just a matter
Mhm.
of mindset, getting out of your comfort zone, and get the bigger perspective of life.
Mhm.
So I have a series of questions here that I'm gonna just randomly pick one for you, and the one that came out is one from Simon Sinek that asks, "What advice did you get from someone earlier in your career that you followed, but now in hindsight, wish you hadn't?"
Wish that I hadn't. I feel like I get advice every day. I think I have okay, what advice do I not follow? Gosh, these are very deep and very like I wish there was like a disclaimer. Please bring your Dalai Lama hat. I don't have a Dalai Lama hat. I have to really think about it. I wish I had given an advice that I didn't.
No,
You know
it's
what? By the time that advice really sinks in, okay, here's the situation. I have to be honest about it. Problem is, I do have this attitude about advice that when somebody gives me an advice and it doesn't go south, there's only so much time that I can blame them for. After that, I have to think about what could I have done differently? What can I change within myself to change it differently? Or can I just remove somebody from a different? So then after that time, I don't remember that advice for a long period of time. I remember what I like my subconscious mind remembers what I gained from it, but I don't remember because each thought that you carry, whether it's positive or negative, it has an energy. So I maybe because how you're meeting me at this point, maybe if 2 years, 3 years back, if you had met me, I would have a clear understanding of it. But right now, I'm in a place that I'm very, very like mindful of letting go of a thought that does not serve me. Maybe that's why I cannot successfully answer your question. But to me, holding on a thought that does not serve you is a disservice to yourself. So truly, if people have advised me, but in the end, I do get a little bit time to that natural resentment phase. I do accept that within myself. I say it's a normal emotion and I let myself to feel it, but after that time I am in that solution mode because I've seen so many beautiful doctors and nurses and medical people do it over and over again. I have a lot of reference to repurpose that mindset and put it back into my mind. Sometimes when you are trying to fix something, you have to go back and look into your memory lane and like, how did somebody else do it and how I can fix it. So luckily, I'm in a very beautiful profession where I have always worked amongst the best doctors, the best nurses, the kindest people, and even patient population is mostly kind, unless they're very, very sick and in that mind zone of anxiety. I do have a lot of references that I could refer back to, and also my family that I can refer back to, okay, how could have this family member or a friend or a professional person had done it? And so it makes me easier. If they have done it, I can do it. I can borrow their wisdom in this situation.
that takes a lot of introspection though to do that.
Yeah,
Like it's a trait that it's trained. It has to
I'm
be
learning.
trained.
I'm
Um,
learning. Doctor, I'm not very, very expert in it, but I'm like more mindful about it. Like when it comes and I'm like, my body registers it.
so Sarah, If you look back when you started this whole marketing thing with what you know right now, what kind of advice would you give to yourself looking back?
What could I have advice? The same
Speaking
advice that I give
speaking
my
about
clients.
advice.
Yeah. So the same thing now when I look at if I go back and if I, Sarah from 2023, November of 2023 versus Sarah of October of 2025, if they both are like in parallels and sitting, the Sarah from 2025 would have said, okay, let's make a business execution plan first. I started because I saw a very bling advertisement on marketing and all that. And I took the course. It was very expensive course in marketing and all that. I don't apply a lot of things um, from that marketing company. I don't even use the similar tools anymore because I shaped, and it was like 1.5 years into making that I was like, okay, this is how it should be looking at in terms of execution. So now this is what I do. I do people who are newer to business, I tell them before you start branding and start making your own website, let's look at the execution. Today, I was talking to one of the people who came to me. She's a nurse from like Nigeria, and she's like working with a lot of spokesmen across the globe and all that kind of good stuff. I told her, what is your business? What are you selling? She said healthcare consulting. Immediately I thought it's a very generic field. Where is your niche specifications? What are you trying to accomplish? So let's work on a business model. She came to me because she wanted to brand and she was ready to go. And I said, hold on. I look at the business first. How are we? So going back, if I meet the same person again, Sarah from 2023, I'll ask her, do you have a business plan? Do you know how much each thing is going to cost? Do you know what things to prioritize? Do you know where your value is? Do you know what is your mission statement is? Because I was very focal on, okay, this is a business, other people have done it, I can do it too. But I didn't, for the first 6 months to a year, I didn't even try to understand my own self. What do I want to accomplish? The minute I tried to do that, the more I started talking to people, although there's one advice that I love from that marketing agency, because one of the teachers told me, go ahead and collect as many no's as possible. So whatever the cause is, sometimes, the deals don't go well or sometimes not well, but I mean, there's misalignment or, they're not in the same space, what I'm kind of guiding them to do. So in that way, I love that, I'm okay with receiving no, but at least I tried. So that feeling is a very good feeling in itself. So, and I think in the first year, if I had understood that this is also a very beautiful feeling to walk away with knowing what you align with and not align with, that is also a precious gift, which I didn't understand in the first year in business.
Interesting. Sarah, how can people reach out to you? Know more about yourself, your services, your vision?
If they're on LinkedIn, LinkedIn is a very good place. A lot of people I'm very easy to reach. Like LinkedIn is open 24/7 on my profile, but also my website. They can go into www.elysianmedicinamarketing.com. It's a Greek name. So there's a book and appointment and they can reach out. My number is also there and stuff like that. So they can most certainly happily reach out. But I think LinkedIn would be a good place for them to look because they can see how I'm making a difference. In fact, I just reached my 1 million impressions recently. So check out my work, see how it resonates. Please
Congratulations.
do the research about me. I do want people to do research about me so that they know, they have very clear, a little bit more clarity of what to expect and, how I help.
Thank you so much for being here.
Thank you so much for inviting. This was such a wisdom-filled podcast.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.